I found the only thing to be good about it is that you get an injection and you don't think about it. You for 3 months, you just go back whenever you're ready. And I guess the positive is that it protects you from unwanted pregnancies, unplanned pregnancies, I should say. Sorry. And I would say the negatives, I think for me, I found that I had a lot of breakthrough bleeding. And I think because I was quite young using the injection, I didn't necessarily feel like I would like had the confidence to go back and maybe tell a practitioner about the fact that I was having loads of spotting. And it was only actually probably like maybe a year and a half, maybe later when I started using the pack that actually cleared up.
Unfortunately, this is something that we do hear quite commonly, particularly amongst young people, that they don't feel empowered to talk to healthcare professionals, particularly around the problems that they're experiencing. I encourage everyone to, write a list of questions and feel that they can ask questions, particularly around side effects. And we're used to having these questions asked of us. In terms of bleeding patterns with the injection, generally it is better. So about 50% of people at a year don't have any periods at all. And that is why a lot of people that have heavy periods or painful periods really do like the injection. However, as like in this patient's case, it doesn't happen for everybody. Sometimes it takes time and it can be difficult to manage problem bleeding. It can also have an effect on some people's sex lives if they're having irregular bleeding patterns. So don't be afraid to bring that up. There is the option, again, of using a combined hormonal method to help regulate the bleeding and see if that settles things down. It's really important to remember that not having any period or having irregular periods is not going to be affecting your fertility and is just a side effect of how the progesterone-only injection is working. With the progesterone-only injection, compared to other methods, there may be a slight delay of about 3 cycles on average in terms of your fertility. So if you wanted to get pregnant fairly soon, we usually recommend that you use an alternative method because there can be a delay of fertility of up to a year, but it will eventually return back to normal.